Salams and welcome. Thank you for joining me in part number 15 of Breast Cancer Awareness Month, which is the month of October. And today we are continuing with the psychological support or combat mechanisms that patients need to identify with. And today we are looking at the psychology of breast cancer, which is stress management techniques. There are various different techniques that people can use: relaxation techniques, mindfulness, meditation, and other stress reducing practices can help patients cope with anxiety and improve overall well being. Remember that breast cancer and this stress management techniques. So, even though we are speaking about breast cancer, this refers to cancer of any type, whether young or old, male or female, because men also need stress management techniques and women also need stress management techniques, right? So some of the stress management techniques people can use. Remember that stress, let's first identify what is stress. Stress is when the body cannot cope. The heart and mind are working on overload, and the brain is now producing adrenaline and noradrenaline, which stimulates the adrenal glands to now start releasing cortisol. And these are all the stress hormones which prepare the body for fight or flight. And during that moment of stress, the blood supply from the brain, some of the blood supply is diverted to the muscles to pump up the muscles and to prepare you for that fight or flight or freeze reaction. And over time, that body starts absorbing the cortisol, adrenaline, and noradrenaline. But during the time of these hormones, there is damage to the arterial walls. Your heart is being damaged, your brain is being damaged if that stress continues. So, chronic stress is not good. So for patients who have cancer, remember cancer is a chronic illness. It is not like you have a flu for 3 or 4 days. It's not like you broke your leg and now in 6 weeks it'll be fine. Cancer is many, many years and in some cases lifetime. Even if you have recovered from cancer, you always have that nagging feeling at the back of your head that will it come back, right? So cancer is basically a marathon journey for your life. And in this type of situation, you need to combat, you need to find techniques or methods to help you cope with the stress. Every human being is different. Some people start a program of exercise, some people go for swimming or cycling or treadmill running. I find treadmill running is fabulous, or even walking on the treadmill, running up and down your steps, or doing skipping or rope jumping, whatever suits you. You can go to a shopping mall if you're feeling stressed out, have a cup of coffee, go out to a movie, go out with some friends, go to a braai, have a braai. So anything that makes you feel good. When you start feeling good, your brain starts releasing the endorphins or the dopamines. And this is your body has got morphine in the brain. This dopamine and endorphins are basically morphine. So when the body releases this inbuilt morphine, it is actually pure morphine. It makes you feel good because your pain is gone. And in my personal example, I will give you that even though I am on chronic pain with my spinal disability, but when I go out on the rare occasions, as I mentioned many times before, I only go out 3 or 4 times per year because I spend 22 hours per day in bed. So on the very rare occasion when I go out, whether it's to a function, for that 1 or 2 or 3 hours, my pain actually goes away. And the reason why my pain goes away is because I meet so many people who haven't seen me in a long time, and we are smiling and laughing and joking with each other. And whenever you smile or you joke, then the brain releases endorphins and the dopamine. And that acts like morphine and it takes your pain away. So you must decide what stress techniques you need to do. You can squeeze a tennis ball or a squash ball in your hand. You can have these, what is it called? Recently there was a fashion fad, and you'll tell me in the comments below what it is. I can't think of the name. Fidget spinners. Okay, you play with the fidget spinners. You can have mindfulness or meditation or anything else that can help you cope with your anxiety. Or you can watch Netflix, or you can take a lovely book, start reading a novel, Jane Eyre, or any of the other novels that you love, and then see how you can cope and adapt to this lifestyle change that you're undergoing. And if you've got money, many people then go on ship cruises or then say, you know what, I need to now finally go to Orlando Walt Disney World and go see part of the world that I want to. Or the best thing that you can do, and many people have found, they find great benefit in this, is to try and help others who are in greater suffering than themselves. So many people become volunteers. They go to food kitchens, they hand out deg biryani or deg akni or dal and rice, and they help the poor, the helpless, the widows, the orphans, and those in need. Because then, even though you are going through difficulty, by helping others who are worse off than you find that that improves your mental status. It helps to combat your stress, and you feel that now you are making a difference, a positive difference in someone else's life. Stay well, stay focused. Alhamdulillah.